Hi, my name is Brian Apavu. I am a neurologist with an interest in philosophy, the mind, and living the examined life. Today, I want to dive into the hotly debated topic right now of the use of acetaminophen, typically referred to by its brand name Tylenol, in pregnancy and as it relates to autism and other neurodevelopmental disorders. Now, there are a lot of brand new videos that are coming out in this topic, a lot of other doctors who are talking about it. Just because it's a hot topic, and I want to be a little bit more focused and specific and unique in this video because not only am I going to talk about the medical information, but I want to put a focus and light on philosophy and epistemology, which I really think is at the core of why we're looking at all of this data. We're all looking at the same data, but we're not comprehending it the same way. We're comprehending it differently, even though the same data is exactly in front of us. Why is that? This is so important. This is so important to me. It's what I'm actually very passionate about. We're in this place in society where we all see the same thing, but we're comprehending it differently. We're thinking about it differently. We're disagreeing, even though the same information is directly in front of us. And I think this is where epistemology really matters. So this is just, I think, a great example. So let's just go from here. Now, let's start with some quick caveats. None of this, I know I'm a physician, but none of this is medical advice. There's no medical advice to provide in this specific video. This is medical and philosophical education. There are no medical prescriptions to provide here in this video, but perhaps some philosophical ones. So if you need medical advice, please talk to your medical medical professional, not me, but your medical professional, your doctor, your nurse practitioner, whatnot, for any medical advice you have. Very recently, the U.S. Food and Drug Administration announced that it is beginning the process of changing the label on acetaminophen, the active ingredient in Tylenol and many over-the-counter pain and fever drugs, to include a warning about a possible association between prenatal use or use in pregnancy of acetaminophen with neurodevelopmental conditions such as autism and ADHD. The FDA is also sending a letter to physicians nationwide to alert them of this possible link. The White House and Department of Health and Human Services have emphasized that there is, quote, mounting evidence, end quote, for the link and publicly resuscitated older Tylenol tweets cautioning use during pregnancy. The Trump administration, with Department of Health and Human Services Secretary Robert Kennedy Jr. as the lead, has presented this as a priority in its autism root cause strategy. So they put forward an article where they said, fact, evidence suggests link between autism and acetaminophen, and described a number of things that they come to a conclusion that there is, or what they call as fact, that evidence suggests that acetaminophen use in pregnancy, especially late in pregnancy, may cause long-term neurologic effects in children. So in their article or fact sheet or whatever you want to call it, they provide a number of bullet points about a number of things. They refer to a couple studies we're going to get into, the Nurse Health Study 2 and the Boston Cohort study. They talk about biological mechanisms that link prenatal acetaminophen exposure to altered brain development and adverse health outcomes. They talk about a consensus statement that was published. And then most notably, they talk about a recent systematic review that was published by Andrea Beccarelli and colleagues, Andrea Beccarelli being a physician scientist at the Harvard Chan School of Public Health. So we're going to get into that. They have a number of other articles that they have, other links that they have from Johns Hopkins, University of Mount Sinai, that describe certain things, but they're really referring back to the same papers that they mentioned before. So, while they have a different bullet points as though these are different facts, there's a couple primary studies that they're really focused on, and then they just essentially relink it by referring to other press releases or other articles from other institutions that they have. So let's talk about a lot of this. Let's talk about this. So Whenever we talk about a drug and an effect, it's important to talk about, even when we're talking about epidemiology, one of the core components of determining causality in epidemiological studies is biologic plausibility. And there is biologic plausibility that we need to evaluate. So there are rodent studies that have demonstrated that prenatal or early postnatal exposure to paracetamol, the chemical component of acetaminophen or Tylenol, that this can result in altered behavior, including changes in locomotor activity, anxiety-like behaviors, and changes in vocalization, as well as sex-specific neurobehavioral effects and gene expression involving the prefrontal cortex related to glutathione metabolism, DNA damage, and endocrine and immune pathways. The molecular mechanism proposed include oxidative stress, interference with prostaglandin synthesis, and disruption of hormonal signaling. These studies typically use dosages in these rats of about 150 milligrams per kilogram per day, which doesn't necessarily correspond to what we use in human exposures, in human therapeutic exposures. Typical doses of acetaminophen administered to pregnant women and children are about 10 to 15 milligrams per kilogram per dose, with the maximum dose of 75 milligrams per kilogram per day. So the animal studies that have been done, they use dosages that are just way higher than any physician recommends, or there are any guidelines to recommend for clinical care. And with human studies, there isn't a direct correlate. All human studies are observational, including cohort studies, biomarker studies, and meta-analyses. And these are inherently limited by confounding variables that you can't necessarily establish causality. Biologically plausible mechanisms is important, as well as these animal studies, but you need to be able to translate it into human studies to ascertain causality. But that's not always possible. So high dose acetaminophen is dangerous for reasons, including for other reasons in the body, including severe acute liver failure, and doesn't really seem to have a therapeutic benefit of any sort. So it's not appropriate for any human clinical trial to evaluate these animal models at those sort of levels and at such doses. This would be considered unethical. So in the White House's fact article that they put out, they refer to two clinical studies and one systematic review. I know they have a bunch of bullet points, but really when you go down the links and see what's being said, that's from actual peer-reviewed literature, you're talking about two clinical studies that they talk about and one systematic review. So let's go through all of that. So in terms of the systematic review, it was published by Andrea Baccarelli and his colleagues, and it was published in 2025, and it applied the navigation guide method to 46 studies that they were able to identify that evaluated prenatal acetaminophen exposure and neurodevelopmental disorders, including autism spectrum disorder. However, due to substantial heterogeneity, this review did not conduct a quantitative meta-analysis, but instead performed a qualitative synthesis. This is really important because I think I've heard a number of commentators call that article a meta-analysis. This wasn't a meta-analysis. This was a systematic review, and it used a lot of rigid standards. So, but it was a systematic review, not a meta-analysis. The review concluded that there were a majority of studies that reported a positive association between prenatal acetaminophen use and neurodevelopmental disorders, but it did not provide a pooled effect estimate for autism specifically, nor did it claim definitive causality. What it did identify was that among 46 available studies, 27 reported associations, which is significant links to neurodevelopmental disorders. 9 showed null association or no significant lift, and 4 showed negative associations or what might be protective effects. They described that higher quality studies were more likely to show positive associations, and overall, their interpretation was that the majority of studies reported positive associations of prenatal acetaminophen use with ADHD, autism spectrum disorder, and neurodevelopmental disorders in offspring, with risk of bias and strength of evidence ratings informing their overall synthesis. Now, so that was a systematic review that was done, and we're going to go into some of the nuances of some of the studies within it. But just to go through, what the White House had put out, they put that systematic review published in 2025, and they also put two other original studies. So the Nurse Health Study 2, as well as the Boston Birth Cohort Study. So let's talk about Nurse Health Study 2. This study found that in utero, acetaminophen exposure was associated with an increased risk of attention deficit hyperactivity disorder in offspring. The study used negative control exposure analysis to address time-invariant confounding and adjust for multiple maternal and child factors, including maternal age, education, smoking, and indication for acetaminophen use. The association was specific to acetaminophen use in pregnancy, but no association was found for use before and after pregnancy. And of important note, which I'll get into, no sibling control analyses were performed as part of the study. A second original study cited by the White House was the Boston Birth Cohort Study. Here, investigators measured the acetaminophen metabolites in cord blood and reported a dose-response association between higher fetal acetaminophen exposure and increased risk of both ADHD and autism spectrum disorder. The study adjusted for confounders such as maternal indication for use, substance use, preterm birth, child sex and age, and performed sensitivity and subgroup analyses to test their robustness across these different confounders. So they did do some analysis for confounders. However, they didn't do sibling-controlled analyses as part of this study. Now, for those of you who are Facebook friends with physicians, certainly I am, and follow them on social media, you've seen a lot of posts regarding American Academy of Pediatrics or American College of Obstetrics and Gynecology, or just responses by physicians. So major medical organizations like AAP or ACOG have responded to the recent FDA announcements with opposition to the label change. And they have rationale behind those behind their positions that's based on studies that perform sibling control analyses. So there was a published study in JAMA 2024, which was a nationwide Swedish cohort study of 2,480,797 children, where they used prospectively recorded antenatal and prescription records to assess prenatal acetaminophen exposure and subsequent diagnoses of autism, ADHD, and intellectual disability. The initial population-based models, when adjusted for wide ranges of confounders, including maternal sociodemographics, psychiatric history, and other analgesics or pain medications, showed small but statistically significant associations between acetaminophen use and all three neurodevelopmental outcomes, autism, ADHD, and intellectual disability. However, when sibling control analysis was applied, comparing outcomes in siblings discordant for exposure to account for shared familial and genetic confounding, no association was observed for autism or intellectual disability. No dose-responsive relationship was found in sibling analyses. The authors concluded that the observed associations in conventional models were likely attributable to unmeasured familial confounding rather than a causal effect in acetaminophen. Another study published in the journal Pediatric and Perinatal Epidemiology this year in 2025 performed a nationwide Japanese cohort study of 217,602 children using administration data and multiple analytic approaches, including propensity score matching, adjusted models, inverse probability of treatment weighting, and sibling comparisons. In the propensity score matched analyses, small increased risk was observed for composite neurodevelopmental outcomes in ADHD, but not for autism spectrum disorder or intellectual disability. Now, they also applied sibling control analyses, and this showed point estimates in the opposite direction for ADHD, indicating no association. The study also performed probabilistic bias analyses for exposure misclassification and negative exposure control analyses, both of which suggested that the unmeasured confounding and misclassification likely explained the observed association in conventional models. So both of these studies used sibling control analyses to rigorously address confounding, and both found no association between prenatal acetaminophen exposure and neurodevelopmental disorders when familial confounding was accounted for. Both studies also performed extensive sensitivity analyses to address other sources of bias, including exposure misclassification and confounding by indication. So why are sibling-controlled analyses important? Sibling within family analyses are more rigorous tests, although they never are infallible. Within family designs, control for all stable shared familial factors, such as genetics, many home environment variables, and so forth. If those analyses do not show an association while between family studies do, a common interpretation is that the between family signal was likely confounded. However, sibling designs can bias toward the truth when exposure is misclassified, there is some carryover, the true effect varies by timing or dosing, and their studies are underpowered for modest effects. When we evaluate the two studies that I mentioned between in utero exposure of acetaminophen and neurodevelopmental disorders that accounted for sibling control, they appear to be designed to account for these effects. So there have been a lot of statements put forth, and we see things on social media. We see position statements and posts, and I wanted to just the philosopher in me and the person who's passionate about epistemology really wanted to take a look at these and see how we're communicating these sort of results and these sort of studies to to our community, to really see if we can garner shared truth and shared understanding and some consensus with those that we care about and those that we're trying to communicate to. So let's first take a look at this fact sheet and post from the American Academy of Pediatrics. Overall, I like this post. It mostly conveys what I think we want to say epistemologically. It explicitly states that studies do not show a causal link, and it links readers to some primary sources and dose guidance. That's closer to a testable, non-absolutist claim that proves no harm. The headline, "No link to autism," sounds a little bit unfalsifiable and absolute to lay readers, and there may be a better way for us to relay falsifiability in the position here. So, but overall, I think this post is pretty good. This post from the American College of Obstetrics and Gynecology, I have more of an issue with when you take a look at it. I really, from an epistemological perspective, I don't like when medical organizations or medical professionals make the statement, "Science is clear." The issue here is that this is a claim that is unfalsifiable sounding and absolute. We need to be able to say things that invite refutation, that invite falsifiability, something along the lines, we have to be able to communicate towards something along the lines of, to date, stricter tests don't support a causal link. And if we really want to be honest, we want to be able to say what necessarily would change our view. But we really just don't see this, and a lot of times we're just getting an absolutist claim that isn't falsifiable and doesn't invite refutation. And I'll get into why that's a bit of a problem. So why does this sort of thing matter? Absolute language, the science is clear, no link, fact, confirmed safe. These things sound like finality. They blunt the possibility of refutation and invite backlash the moment any study could show a potential stronger association. You can keep the direction of the message while making it keeping it more rigorous toward truth and trustworthy. You can also criticize the White House's statement that fact, there is, things show an association. This data is still ambiguous and evolving. When we come out with the claim that something is a fact, I think obviously fact checking needs to occur. So why does epistemology matter? I got into a recent discussion about epistemology as it relates to these studies and how we're not comprehending each other on social media, and not everyone necessarily agrees, but I think it does matter, and this is why. People aren't dumb. Even if they aren't scientists or experts in philosophical approaches to epistemology and critical thinking, they instinctively know when a falsifiable claim is being twisted to be infallible. People have seen experts make mistakes and be wrong. People have heard the science is clear when it wasn't. The appeal to authority is real and legitimate in society. People see it in all aspects of modern society, and they have the right to be skeptical. Claims cannot be infallible. They can always be subject to skepticism and to testing. People in society are right to carry skepticism of experts based upon our history. And the neurologist, I talk about the black box warning of suicidality with anti-seizure medications when I talk about it with patients, and I put it in context to the benefits and risks as it relates to the specific patient in front of me. This is part of my job. Part of my job is to talk about it, and part of my job is to put it into context to the patient and to what evidence. What's the data that supported the statement and what are the limitations behind it? So that's just part of my job. And similarly, when the FDA puts out anything, that's part of our job as physicians, is to make sense of it and to make sense of the rationale behind it and the limitations of it. To date, the FDA has not issued a black box warning for acetaminophen in pregnancy. Instead, the guidance emphasizes using the lowest effective dose for the shortest duration and only when medically necessary. So why is this announcement such a big deal? I think it just really comes down to politics and emotion and our attention economy. We are emotional related to individuals and politicians and certain people, and at times, these sort of things occur and people react really abruptly, and sometimes, and that's just, I think, why it's considered such a big deal now, even though throughout the history of medical literature generation and the government's announcements about drugs and risks and side effects and warnings, this stuff happens all the time, but we're just very, very focused now, I think, because of the people involved and the politics involved and the news's focus on it more so than other times. So for physicians who are upset about this, I think we deal with this all the time. I think the only thing that's really different here is, politics and attention, but in terms of evaluating medical data and appraising data and looking at it, in terms of confounding variables, causality, the appropriate matching, risk benefit, we deal with this all the time, and this is just part of our job. So if you really have a problem with this, I mean, this is kind of what patients come to us for, is to make sense of this. I don't think statements like "the science is clear" is really helpful. The science isn't clear to the general public, and instinctively, however, discrepancies in epistemology can be more clear. Scientific and medical data, as we discussed, can be nuanced, detailed, and confusing. But when it comes to epistemology, even if we're not experts in epistemology, people get it when falsifiable claims are put forward as unfalsifiable with things like "the science is clear." For me, and making this video as well as other videos on this channel, I really am not fundamentally focused on politics. I mean, I talk about topics that are politically active and popular, but I'm not interested in the politics in terms of political action. I'm not interested in commenting on specific politicians, what they do and what they should do. I'm not interested in political action. My purpose here is to make videos that focus on us as individuals in the community, how we can think critically and how we can come to shared understanding between each other together to make a better world. I don't think that politicians are the ones who are going to save the world. Politics, in my opinion, is really about power over truth. They always prioritize power over truth, where what we really need to do is get closer to truth. And I think to that end, I really focus these videos on us as individuals, whether we have some expertise and we want to share it with you, or share it to the lay public, or just, us being individuals in the lay population, just all working together to make a better world. I think that's, if we have a shared understanding and we understand the nuances of how to critically think and how to take information together and to accept limitations of data and things, and just, calm down and look at it with an element of falsifiability to major claims, I think we can come to a shared understanding together. So I hope you liked this video. If you did, please like this video and subscribe to my channel, and we'll talk again soon.